Before the next patient is brought in, the treatment room must be cleaned. The dental assistant washes her or his hands and puts on utility gloves. Plastic barriers from the lights, chair, and X-ray head are removed. This helps prevent potential contamination and protects the dental staff and the patients. Used cotton balls or gauze need to be disposed of in special biohazard containers. The assistant brings the instrument tray with the used instruments to a cleanup sterilization area. Countertops and other uncovered environmental work surfaces are disinfected, as well as any area of the room that was contaminated by spatter. New plastic barriers will be replaced before the next patient. The assistant may return to the sterilization area to clean the instruments if there is time between patients. Breaking up and removing heavy debris can be done by hand or by using an ultrasonic cleaner. Using an ultrasonic cleaner is the preferred method. When using an ultrasonic cleaner, the dental assistant places the dirty instruments into the ultrasonics basket. For proper cleaning, all instruments must be fully submerged in the solution, and the basket must not be overfilled. If the basket is overfilled, the instruments will not be cleaned. The lid is then closed, and the ultrasonic cleaner is turned on. The instruments remain in the ultrasonic for approximately 15 minutes. The basket may be removed, and the instruments are rinsed, checked for cleanliness, dried, and put into a sealed and labeled bag or placed into cassettes. Since not all offices have an ultrasonic cleaner, an alternate cleaning method is scrubbing the instruments by hand using soap and water and a long-handled scrub brush. If scrubbing by hand, scrub under water, pointing the spray away from you, and wear utility gloves. Once cleaned, the instruments are rinsed thoroughly in tap water and then dried on a towel. When dried, they are bagged and put into a sealed and labeled bag in sterilization pouches or placed into cassettes. Sharp tips may be wrapped in gauze or foil to prevent puncturing the bags. Caution should be used when handling sharp or double-ended instruments. Puncture-resistant gloves should be used when cleaning sharp instruments. The next step is sterilization. The bagged instruments are placed into an autoclave for sterilization. The autoclave should not be overloaded in order to allow the steam to sufficiently kill all microbial forms. The temperature and pressure of the autoclave must reach the manufacturer's recommendation before the sterilization cycle can begin. Because of the pressure, an autoclave should never be opened until a safe internal temperature has been reached. If opened before the cycle has ended or before the unit has cooled, severe steam burns could occur. Check manufacturer's guidelines for a safe cooling temperature. When first removed from the autoclave, the instruments may be put in a drawer or on a tray designated for sterilized instruments, as they are hot and need to cool. Once cool, the instruments may be put away. If there are any questions on proper sterilization procedure, the manufacturer's instructions are to be followed. Some dentist's office may use color-coded trays for different setups. The dental assistant presets trays according to specific procedures and places them in special cabinets. Instruments should not be removed from their sterilization bag until just before the patient's procedure is ready to begin.